All right. So, oh good, we're already on that page. So last week, we moved up to the yellow. I think over that total of those 2 weeks, we had 6 cases, and 6 seems to be the magic number to put us into the yellow. I'm expecting, I personally am expecting us to stay in the yellow by tonight, but you never know. We've had some cases show up this week, some in the older community, some younger. I don't think any of these cases, correct me if I'm wrong, Jen, from talking with Kate, I don't think any of this week's extra cases were in the schools. We're still going back to last week.
Correct. That we only had one close contact. Who, the child tested negative, but his father tested positive. So that was our only connection to the schools. And the teacher that we had test positive, we did have the student test positive, and then he and his father tested positive, but he hadn't been in school for a week when he tested positive. And then, so we had to do very minimal contact tracing. And then we had a staff member who's not in the Southwick numbers, but would be in the Westfield numbers, who did test positive. But that's it for the schools.
We're still trending pretty high testing. If you look on this, the total number of tests for the last 14 days, 457, which has put it up to 3,783 people in town have tested. That's, over a third at this point, which I mean, it's good that we're getting all these testing. Let's see, so Granville also popped up last week. And it popped up that there were 2 cases. I spoke with the nurse that covers Granville. Hamden County has hired, well, we've had it for a while, has a public health nurse that covers some towns that don't have nurse coverage. So it's kind of good that we have a good relationship with them. She said that as far as she knows, she has only 1 case. So we have 1 case for Granville, 0 cases for Tolland. And then now we're, those are the only 4 cases we have here in town. Let me see. Hold on a second. Close tab. This is the last week's testing versus positive numbers we've had in town. It's still kind of trending in the same sort of way. A lot of people testing, at least we're only getting a handful of cases. So not too much has changed since the last meeting, except for having cases now in the school system, which thank goodness that I feel like it's sort of like a marathon that we've been going on now. And oops, okay, how do we get back? Screen sharing is shut. Okay, and all of our hard work has sort of paid off. So, we've been exercising everything. The schools, you've been exercising all your protocols. And when it comes down to it, we just adhering to it. It's the easiest way to go and plugging on forward. Some other things that have popped up COVID wise. We've been doing the flu clinics are another big part of what's going on. I was been talking to Marcia about trying to see if we can get tents for the flu clinics. And I know we talked about tents possibly for a mass prophylaxis once it comes time for COVID. But I was just reminded yesterday as I was bringing up this topic with our county FET planner that we still have $1,500 at our disposal. It's called the BIDLS grant. I'm not exactly sure what it stands for. And it's for immunization for seasonal flu. So I'm going to look into using that $1,500 and see if we can get maybe an extra tent for doing just the regular seasonal influenza vaccinations, which we can parlay into, obviously, COVID when that pops up. And it's quite possible that if Granville or Tolland isn't partaking in that, and since we regionalize everything, we might be able to see whether or not that $1,500, if they're not using it, can come to Southwick too, since we do have regionalized EDS and regionalized school system. I'm not, I'm holding my breath for that one, but it was posed to us that maybe we could do it that way. The other topic is kind of working on our emergency dispensing site planning. I've been talking with our FET planner quite a bit about this, and it's sort of the conversations change every week as to what we might be looking out for once we start doing mass vaccination for COVID. Some of the topics that they've brought up, and I think people probably have seen this sort of in the news, is it's might be more than likely that vaccines are going to have to be stored at a colder temperature than your typical flu vaccine. So what's that going to look like? We've already, Region 1 has already, we've gone through, we had a refrigeration survey last year, and we were able to identify a couple of spots that would be able to both provide refrigeration of the correct temperature and security. So that's, something to be looking at. They said it's probably going to be similar to flu vaccine. Well, it would have to be stored at a lower temperature. It's going to be the kind of thing that it will be easy to transport, and it wouldn't have to be stored refrigerated at the day. So there's still things that we'll have to look into in our planning. Other things that they warned us, we probably won't be getting large amounts. We won't be getting lump sums. So the whole EDS model where we're trying to vaccinate in 48 hours isn't going to be something that we're going to have to stand up to. So we'll probably be looking at more like smaller clinics and more manageable clinics, which I'm all for that, because standing up full EDS is an exhaustive event. The state has also purchased the ProMed scheduling and insurance coverage app. So when that comes down to it, we would be able to say, schedule clinics, say we have a day. It's very similar to how Cindy did it for the seniors. And people be able to put their insurance and whatnot, if it even comes to that, on an app. And so everything is ready to go when people show up. Mm-hmm. Another thing that they talked about is which would be different than a traditional EDS, is that because this is a new vaccine, we might be talking about having that 15 to 20 minute wait period to just check for adverse reactions. So this is probably not going to be something we're doing in a drive-through form. It might be similar to a regular flu clinic. Lots of things have been thrown out, but so far those are more just ideas about what might be happening in the next couple months, but nothing solid or set in stone, which is where I'm going to be sending everybody who needs to be part of it invitations to do EDS planning and have EDS planning session. Because I think the best thing to do would be to reviewing what we have our plans and asking questions about how we can go forward with all the information we have at hand. I'm probably going to look into November to do that. Let's see, is there anything else anybody else could think about COVID that they might have been wondering about that I could maybe answer with, or maybe not?
I mean, is there a time frame for the projected vaccine?
No.
Nothing like, plan on January or wait till March or?
No.
Okay.
There's lots of rumors going around, but PH has no official, or even they wouldn't even speculate. They're not in the business of doing that.
And would MEMA,
a group that is going to put something into an order on a Saturday and give us the information on a Friday, I think is what we've learned over the last 7 months, 8 months.
Tammy, a bit beyond that issue, there's been discussion about the criteria of who should receive the vaccination first, whether there'll be certain targeted groups.
No, that has not been brought up. So one of the things we'll have to probably discuss is what we consider if we are going to be getting limited supplies, which is probably in actuality, critical infrastructure to the town. That would be, you know, force protection, public safety, depending on, you know, medical providers, things like that. So those are things that we would actually be talking about and looking into when we do a planning session. But not yet. If I were to speculate, I would assume this would be similar to other years where we'd want to get the elderly population, but that hasn't been given down to us yet.
All right, thank you.
I mean, I have no extra information, but if there's any questions, just let me know.
Thanks, Tammy. Anybody else have anything from the schools as far as COVID?
I could just tell you that we had a call with our commissioner last week, and he is saying that schools are not the super spreaders that people thought they were. We've been vigilant with the mask wearing, the hand hygiene, and the 6 feet of distance. And we're finding that we really don't have any close contacts, even when we're sending people home. We are transparently reporting our number of negative cases that we're getting reported to us and our number of positive cases related to schools on our website. And we're reporting out on them at every school committee meeting. And we are just trying to keep the parents in the loop. We have a process now in place that our close contacts are contacted before the district letter goes out. So if you receive the district letter that there is a positive COVID case and you have not been contacted, then you are not, don't anticipate getting a call that you're a close contact, because close contacts have already been notified before the letter goes out. So that's how we've communicated it to parents. We've had very few. We're taking an extremely conservative approach to close contacts. We're expanding it a little bit beyond the definition. We're doing close contacts even outside of the school day. So we're really trying to be super cautious, conservative on our approach.
Tracy, you got Jean left her phone here, so I
But-
can't.
But the main thing we're doing is trying to keep our doors open for teaching and learning. And we are finding that parents are super appreciative, and that's not to toot our own horns, but we just received the data from the state, and Southwick, Tally, and Granville has the greatest percentage of in-person learning in all of Western Mass. So for that, we have 30.9% of our kids in-person learning 5 days a week. So I'm really proud about that. So we haven't found the need to close any of our schools yet. So I'll keep you posted.
Thank you. Anyone else?
I just have one item, if I could. One of the things that we've had to cancel at the department was the Sharps collection. We have a program through the Department of Health that, we're going to be working, the chief is working on a program right now to maybe have like a one-day take-back collection or something like that. And there's a couple of factors that are impacting that. It's the construction that's going on here at the fire department. We want to get that completed so that we could probably have maybe just like a drive-by delivery or something along those lines. So we're working on it because we get a call a day asking about Sharps collections. And so we want to get that program back to some capacity. So we'll let you know, we'll keep you posted on what happens there.
Okay, sounds good. I know we did open back up our drug collection box in our
Yeah.
lot recently, so. Good to know. Thank you. Anyone else? Okay, seeing no one, we will move to the next new business here, brainstorming topics for future meetings. Does anyone have any ideas here?
I have a thought.
Charlie?
Kinder Morgan, are you hearing me okay, Rhett?
Yep, I'm hearing you fine. I can hear you, Charlie.
Okay, Kinder Morgan has a compressor station. And the thought was, once we get back to somewhat normal, maybe do a walk-through orientation, or have Kinder Morgan do a video of the facility and present it for a Zoom meeting as to what it's all about, their operations, their security, and what their actual mission is for compressing the natural gas to sending it up north. So just a thought.
This is the station on Feeding Hills Road, just below.
That- By Calabrese, just
Yep.
below Malicious, yes.
Can certainly look.
Chairman?
Yeah.
Yesterday, myself, the police, fire, public works, and emergency management, we had a conference call with the Eversource officials, and included within that is the fact that they recently acquired Columbia Gas. So we've asked those community liaison specialists that handle both the electric part of the company and now what would be the gas part of the company, which is gas retail, not to be confused with the wholesale stuff that Charlie's talking about, to also potentially come to a future LEPC meeting to inform us about what's going on with the electric and gas company utilities.
Thanks, Carl. Anyone else?
I had a thought, kind of based on an incident we had the other day where at Town Hall, they had the early voting, and it kind of led me to think that what would we do in the event that we had somebody that took action, like not so much a terrorist attack type of event, but almost to sabotage the efforts. So it would kind of it could be technologically involved, where there's IT involved, or it could be something as simple as just creating a disturbance. So kind of being prepared for something like that. It's kind of small scale, but it's something that could have a significant long-lasting impact on the town as well as the residents, especially, for presidential elections and things of that nature.
Okay. Thanks, Deputy. Any other ideas? Randy?
Are we going to do another tabletop exercise at some point?
At some point, that is the plan. I did talk with our MEMA rep the other day. There were some concerns as far as having the one during the meeting today because of some sensitive materials that didn't need to go into the public record. We're still going to be having one at some point. Her advice at this point was that the rules have been relaxed thus far. She was supposed to check in and get back to me as far as our current accreditation goes. If we're currently certified, she had questioned whether or not that was still in effect. I have not heard as of this point, but she basically said that, not doing that exercise this year is not going to hurt us going forward. Anyone else? Okay. So with that in mind, we'll move to old business. Does anyone have any old business they'd like to discuss?
No.
Seeing none, I would.
Red, I do have some business. It's not really old, but it's pertaining to annual activities.
Okay.
We just recently did a Northeast earthquake exercise. I did that with the Buildings and Grounds Supervisor, and we do it with emergency management for a simulated emergency earthquake happening throughout the United States at 10:15 in the morning. And then what we do is we have kind of a walkthrough aftermath to see what is loose, what needs to be fastened to walls, or heavy objects up on high levels that could fall, or hazardous materials that might be stored and mixed together when they fall on the floor. Also, and that's done annually throughout schools and faith organizations, public safety, government, both at the federal, state, and local level. I have the emergency management, or not emergency management, the emergency response guidebooks, and here's a 2008, but they come out every 4 years, and I just received a carton from MEMA, and they will be be distributed today to DPW, police, fire, and dispatch. I only was able to get one carton, but hopefully there will be another allotment for us. And this is the new updated 2020 version. It is also available online. You can download onto your apps. It's called the Emergency Response Guidebook. And it's very thorough, and it covers everything from flammable, explosive, poison, toxics, oxidizers, radioactive, and corrosive items that would be used for transportation and storage and local use under the Right to Know Act. Let's see. Also, emergency management members attended a virtual online pipeline emergency response training. And we do this every year. And we attended it with Springfield and Agawam and a couple of the other local communities. And that's done every year. That's all I have.
The emergency response guidebooks, how many physical copies of those are we getting?
You're going to get one for each cruiser, and it looks like you're going to be getting about 10 to 12.
Total?
Yeah, that will be, well, no, that will be for law enforcement, police, 10 to 12 for fire, which will be the trucks, ambulance, animal control. What we try to do is we try to have one available in each vehicle that has radio control to dispatch. And then dispatch will also have a copy. I don't know how familiar people are with it, but it has a listing of the number of the product, and it's by number, response guide number, by name, and then it can correlate back to the orange, which is the response activity for isolation and evacuation. And then you also have the critical items that are initial isolation, for, which is listed for green. And these are the very high items that are intense for evacuations and life-threatening. So it's a very thorough book, and it's pretty much self-explanatory once you get a hold of it, but it covers just about everything that's needed. And this is mainly for public safety.
Good. Thanks, Charlie. We'll keep an eye out for those. Anyone have anything else? Okay, with that in mind, our next scheduled meeting should be January 21st, 2021 at 9:30.
Isn't it the 28th?
28,
28?
2021.
Probably looking at the wrong calendar.
Right?
Is it the third Thursday?
Fourth.
Fourth Thursday would
Fourth Thursday.
be the 28th then, 2/8 at 9:30. So with that in mind, I'll entertain a motion to adjourn at this point.
I'll make the motion, Mr. Chairman.
For a second,
Second.
all in favor?
Oh, I have to do a roll call. Who seconded that?
Karen.
Doug Moglen,
Yes.
Carl Steinhardt,
Yes.
Charles Dunlap,
Yes.
Rich Stefanowitz,
Yes.
Tammy Spencer,
Yes.
Brett Banish,
Yes.
Randy Brown,
Yes.
Cindy Sullivan, yes. Jennifer Willard and Steve can't
Kane.
vote. John Kane,
Yes.
Karen Zorek.
Yes.
I feel so impotent, I can't even vote to end the meeting.
I'm so I'm sorry. Surprisingly, the motion passes. Everyone have a great day.
Bye.
Thank you.
Be safe, everyone.
Yep. Bye.
Bye.